Colorectal cancer is the third most common malignancy in men, preceded by lung and prostate cancer, and the second in women, immediately after breast cancer. In 2020, approximately 43,700 new diagnoses of colorectal cancer were estimated, with a 5-year survival from diagnosis of 65.3% in men and 66.3% in women. In this video, we will go to see the characteristics of colorectal cancer, what are the symptoms, the causes, how it is treated, and what prevention consists of. Colorectal cancer is the most common of the gastrointestinal tract and forms in the tissues of the colon or rectum. The colon is the terminal tract of the digestive system, has an average length of 15 meters, and is divided into 4 sections: ascending colon, transverse colon, descending colon, and sigma. The colon has the task of absorbing water and electrolytes, and synthesizing some essential fat-soluble vitamins from waste substances, whether they are eliminated from the body. The colon, together with the cecum and the rectum, thus forms the large intestine. The rectum, on the other hand, is the terminal part of the large intestine, is about 13 to 15 centimeters long, and serves as a temporary storage site for feces, which will then be expelled through the anus. How is it formed? About 80% of colorectal cancers originate from an intestinal polyp, growths due to an abnormal swelling of tissue that forms on the lining of the intestine. In the vast majority of cases, these are new formations of benign origin, but some types of polyps can turn into a malignant cancerous lesion within 7 to 15 years. Polyps are therefore considered to be precancerous, although not all are at risk for malignancy. Those capable of growing and evolving into colon cancer are adenomatous polyps. Like all cancers, colorectal cancer is also due to an uncontrolled proliferation of the epithelial cells of the mucosa that line the inner wall of the intestine. Colon cancers are nearly 3 times more common than rectal cancers. Colorectal cancer occurs in half of cases in the sigmoid and rectum, in 1/4 of cases in the ascending colon, and in 1/5 of cases in the transverse and descending colon. The most common type is colon adenocarcinoma, while the much rarer ones are colon squamous cell carcinoma and undifferentiated carcinoma. Symptoms. Symptoms are highly variable and depend on the type of tumor, its location, and its extent. It generally grows slowly and may not exhibit any particular symptoms for a long period of time. Among the main symptoms of colorectal cancer we find fatigue, unintentional weight loss, and lack of appetite. Change in intestinal activity with a change in stool consistency, and constipation alternating with diarrhea. Pain localized in the abdomen or anus, abdominal swelling and cramps, and anal itching. Presence of blood in the stool and leukorrhea, and when there is an abundant presence of mucus in the stool. However, these are symptoms that do not always indicate the presence of colorectal cancer, but can also be due to many other intestinal diseases. Causes. The causes are not entirely known, but we do know that it is the result of a slow accumulation of genetic mutations in one of the cells that are part of the colorectal. There are some factors that can increase the risk of developing colorectal cancer. Let's see what they are. Age. The risk of contracting colorectal cancer increases with advancing age. In fact, it mainly affects the population from 60 years of age, and is very rare before the age of 40. In recent years, however, cases have also been increasing in younger subjects. Diet. A diet rich in saturated fat, red meat, and processed meat, and low in fiber, and is associated with an increase in intestinal tumors. On the contrary, a diet rich in fiber, with adequate consumption of fruit and vegetables, seems to have a protective role for this type of cancer. Obesity, smoking, sedentary lifestyle, and excessive alcohol consumption. Chronic inflammatory bowel diseases such as ulcerative colitis and Crohn's disease. Genetic factors. It is possible to inherit the predisposition to get colorectal cancer if some illnesses have occurred in the family, such as adenomatous polyposis, diseases characterized by the presence of numerous polyps on the inner walls of the colon and rectum. Lynch syndrome, an inherited genetic condition that increases the risk of developing various malignancies, particularly that of the colorectal. Familiarity. According to some studies, the likelihood of developing colorectal cancer increases 2 to 3 times in people who have at least 2 first-degree relatives with colon cancer, compared to individuals who have no case in the family. Treatment. Therapy always depends on the stage and grade of the tumor, as well as on the characteristics of the patient. If the tumor is in its early stages, surgery is carried out, removing only the small part of the colon affected by the tumor. If, on the other hand, the latter is more extensive, it is necessary to remove the entire section of the affected colon and reunite the 2 sections of the intestine located above and below the eliminated part, thus recovering intestinal functionality. In other cases, this is not possible, and the ostomy is carried out in the opening of the intestine on the abdominal wall, with the creation of an artificial anus, thus allowing the collection of feces. Surgery is often combined with chemotherapy and radiotherapy. Biological drugs have also shown important results in the treatment of colorectal cancers. They are able to interact with certain proteins found on the surface of cancer cells and interfere with their function to slow or block the growth of the tumor mass. Among the drugs used, there are some that act against the growth factor of the vascular endothelium, thus blocking the formation of new blood vessels. Prevention. Controls to detect colorectal cancer are part of a national screening program dedicated to the early detection of colorectal cancer. The most common test allows you to detect occult blood in the stool. It is scheduled every 2 years for all people between 50 and 70 years of age. Undergoing regular checks allows you to identify polyps in the early stages and remove them before they can turn into malignant neoplasms. To prevent colorectal cancer, the same recommendations apply to all types of cancer. Exercise regularly, follow a healthy and balanced diet, keep body weight under control, limit alcohol, and stop smoking.